Humedica is an application that interfaces with our electronic medical record and mines data from there, and then allows us to run reports and queries that are meaningful for our providers. We can look at our patients a couple of different ways. We can look at them from a preventive care standpoint, where we try to find patients who are overdue for tests or haven't followed up with their providers, and we'll ask them to come in eventually, and we'll start reaching out to them and calling them in our outreach program. We'll also look at patients in specific disease cohorts, and we'll look at patients who are at risk for complications and long-term risks that are associated with their chronic illnesses, and who are poorly managing their chronic illness, and have them come in to follow up with their provider in an attempt to prevent all those comorbidities that they're at risk for. Wilmington Health is looking at this data because we care about our patients, and we want to help patients maintain their health. We want to make sure that they're coming in to see their doctors, and we want to make sure that they have everything that they need to maintain their health properly. Wilmington Health has both primary care and specialty providers, and they'll all be involved in the Humedica data that we're able to mine, and all of that information will be shared among our providers in an effort to coordinate care and make sure that all of our patients receive the best possible care and the best outcomes. Hopefully with Humedica, we're planning to develop an outreach program, and it will allow us to have patient care advocates that will reach out to the patients that I mentioned before who need follow-ups or who need help maintaining their health, and we'll get them in to see their provider. While other practices may have an electronic medical record, we're actively using Humedica to act on that data and to mine that data and make it useful for our patients. It makes Wilmington Health different because we're able to practice efficient and effective population management.